shift gears and hear from our students now, because we're really excited to have 3 of our current nursing students with us this evening, to just share a little bit about their experiences. So I have a few, excuse me, I'm sort of losing my voice after this week. I have a few structured questions for them after they do just brief introductions, and then we'll open it up to all of you for questions for them. So what I'll do is call on each of you individually, and then if you want to share, your name, where you are in your BSN program at the moment, let's see where you're from, and we'll just start pretty simple with that. So Alex, I'll ask you to go first if that's okay.
Yeah, it's great meeting all of you. My name is Alex Goldenberg. I'm from Kalamazoo, Michigan. So it's Southwest Michigan, and I'm a first year student in the traditional BSN program, and so far I really like it. Very different from, like they said, like chemistry and all of the prereq classes, so it's really good being here.
Wonderful, thanks, Alex. Annalie, do you want to go next?
Hi, everyone. My name is Annalie Garcia. I am a second year in the traditional BSN program as well. I'm from Milwaukee, Wisconsin, so not too far from Madison. And yeah, I look forward to answering any questions you have.
Wonderful, thanks, Annalie. And Nicole.
Hi, guys. I've been seeing lots of you this week. But to reiterate, my name is Nicole Bartels. I am a first year BSN student, traditional BSN student, and I was born and raised in Madison. So I look forward to your questions.
Wonderful. Nicole, I'm going to pass it right back to you. Do you want to just again remind the group what your journey into nursing was?
Yeah, so I had spent a lot of time with my little cousin at the American Family Children's Hospital here in Madison, kind of being used by my aunt as like a distraction tool. And through that, I was kind of immersed in healthcare and nursing specifically, and I really admired all the nurses that were there and how they took care of my family that I cared about. And so that kind of led me to decide when I was about 10 that I wanted to be a nurse, and I never looked back.
Wonderful. Thanks, Nicole. Annalie, what was your journey into nursing?
Yeah, so when I was younger, a few years back, my oldest sister was diagnosed with lupus. So she actually wasn't expected to live past 19 years old. And so she's a few years older than me, but she was in the hospital a lot. So I was able to see her at, a pretty low stage in her life. But then, things started looking better. She had a lot of varying experiences with nurses, mostly good, but she had some negative experiences as well as being a woman of color in the hospital. So I knew I wanted to go into nursing at that point because I wanted to take all of her experiences and all of my observations and become a compassionate nurse that treats everyone equally and also gives back to the community and help women of all backgrounds specifically.
Thank you for sharing that, Annalie. Alex, you want to tell us a little bit about your journey?
Yeah, so I actually came into as a freshman, not really sure on what I wanted to do. I knew I really liked science, and I was thinking maybe a science teacher, but then I stayed the summer and I thought, why not get my CNA, become a nursing assistant? And so I got it, and I worked in home health. And that was such an eye-opening experience. I loved the relationship that you had with you and the patient, and just being able to work alongside the family. And it was, I really loved it. And I was like, well, I really want to pursue nursing. So I decided to apply, and yeah.
Wonderful. The three of you are actually giving really good segues to my next questions here. So do you want to just explain to the group a little bit about the application process and how you approached that? And again, just kind of giving them some insight in what, our students go through to get into the program. So I'll actually open up to any of you if you want to jump in.
Yeah, I can go first if that's okay with everyone. So let's say about 2 years ago now, so it's you start thinking about the application your sophomore year, and I participated in an organization that I'm also still a part of called the Multicultural Student Nursing Organization, which is MSNO for short. And basically what it is there's an application. It asks you a number of questions, and it does take a while. It takes a lot of reflecting, and it based on how the questions are worded and how they're asked, they really want you to dig deep into why you pick nursing. And it's a pretty holistic approach, which I found really comforting, because it makes me think, like, do I really want to pursue nursing? Why do I want to do it? And if I do continue this journey, how am I contributing to society? So we do the application, and then the interview, I feel like, was the scariest part, just because the questions are pretty general, but it also makes you reflect on the spot as well. And then the same day you do your interview, which is in the spring semester, you also have 20 minutes to answer a writing prompt. And that prompt is, when I applied, it was about a challenge and how you overcame it. So it wasn't even a nursing question, but more of a question on your character. So I would say that the application, I mentioned it earlier, is a holistic. So they really want to see your character and how you would contribute to nursing, which I thought was pretty amazing for an application.
Nicole or Alex, do you want to add
Yeah.
anything?
I obviously answered similar questions and followed that same interview process. Also, my neighbors just started playing music really loud, so I'm sorry if you can hear that. But what I really enjoyed about the process of the I guess the essay writing is how I would describe it, since they were a little bit longer than a short answer question, was just how they were looking for how your life experiences have prepared you for becoming a good nurse. And everyone that I know has had completely different life experiences going into their applications. And so I think that really just shows how much they look into what we're actually saying and think of all of us individually and really apply what we say to what they're looking for, which is something that I really think and admire about the nursing program.
Yeah, I definitely agree with Nicole, and I definitely agree with that. And for me, it was kind of weird going in, because your first 2 years, freshman and sophomore year, you're not directly admitted. So you have to take some time to work up, do the prereqs, and really kind of figure out if you do want to be in the nursing program. And I think in those 2 years, me, and along with, I guess, everyone else in my class, we really got to reflect on if we wanted to go through the whole nursing application process, because it wasn't just like an interview and you're done. It had essays, timed writings, an interview, timed writings, essays. And so it was a lot. And the application, it took several months. They gave us actually a full month to work on it, so it was a pretty heavy process. And the fact that we had the first 2 years to really think about if we wanted to do this and if we wanted to try, I think that really prepared me and put me in the mindset of I really do want to be a nurse, and my past experiences really have led me to want to try and pursue it. And also, as Nicole also mentioned, the how it's like they look at you as like a whole person. So there's not just like a specific like checkbox you have to do in order to get admitted. It's just everyone comes from different experiences, and it's really it's really nice to see that, and kind of look around at everyone in your class and say we all got here and it was for different reasons, and you can see it through through the class and everyone who you meet.
Wonderful. Thank you, Three. This next question was actually asked by the class of 71 last year, and I think it was a good one. But could you talk about how you utilize class materials like textbooks, or, what your learnings online look like? Because it is a lot different from 50 years ago and how we, had information given to us. So you want to talk about just, again, some of the sort of technology sort of tools that you use through classes?
I'll go first. Something that I have found really helpful is they kind of send out, or the links, we bought this platform that shows videos specifically of what we are going to be practicing maybe in lab, or of things that we'll probably see in clinicals and stuff. Some that we've seen, obviously I'm only so far into nursing school, but they have like hand hygiene and occupied bed making and stuff. And for those who may not have had CNA experience, with these ones that we've seen so far in our beginning weeks, I'm sure they're so helpful, because we kind of only have a limited amount of time in lab. Even if it's hours, you can't teach everyone everything. And so I think these labs, or these videos, people can rewind them if they were confused. People can watch them however many times they need to really feel confident in their abilities, so that when we go into lab and when we go into our clinical settings, we can feel confident in the skills that we need to know because we were shown them.
Yeah, like Nicole said, the videos are super helpful. I never got my CNA, so even videos on how to properly ambulate patients was super helpful for me. And just to see it first and then practicing it, it helps so you don't just, go into lab blind and just have your instructor show you one time and then just have you repeat after them. So I think that was a pretty unique tool that I definitely used many times. I've rewatched videos a countless number of times. In regards to textbooks, I think that has been the trickiest for me personally, just because I am a visual learner. So sometimes textbooks aren't the best tool for me, but I do appreciate when my professors highlight which parts go with the lesson plan. And a lot of the textbooks now use key concepts. So they point out the main takeaway from chapters that we have to review. So I think that has been helpful for me as well. And another thing is when professors bring out online resources and videos. So when they bring out stories from actual patients to personalize things, I think those are super helpful as well. And then one more thing, and then Alex can go, is that we used to have what is called the Nursing Learning Center. Jordan, I don't know what it's called now. I know they changed the name, but before they used to provide extra sessions to help practice some skills and even math practice, which is not easy for everyone. So I really appreciated those extra hours that faculty put in, and also teaching assistants would come and help us as well.
Yeah, I was just going to mention, so the Nursing Learning Center actually was never a center, so it was a little bit confusing. It's actually just more of a programming tool that we use through a variety of ways. So it's now called the Career and Student Success program, I think. It's like four letters in an acronym. We love our acronyms here, don't we? So thanks for pointing that out, Annalie. Alex, anything else to add?
I think definitely the videos and helping rewatching everything does help a lot. It makes you more confident going in, and everyone appreciates that. I also like how with the textbooks subscriptions that we get, because everything is online, there are additional resources that we can use like within the textbooks, or little, I guess, like elements to help. I know with some resources that they offer, you can make flashcards within it and save it, which is really nice. You can highlight it. And then also you can take notes as well within the textbook, which I think is really nice, because I know with a physical one, it can be hard to write in the margins, but I really like how easy it is to use, and more, I guess, studying access it gives you.
Wonderful. My last structured question for the three of you before I open it up to the group. What does a typical day look like for all of you? And again, I think there are some big differences between your first year and your second year. So Annalie, I'll be really interested in your perspective as now a second year traditional student.
Okay. Usually I get up pretty early, and I take the bus, and the bus goes straight to the nursing school. It's only a 15-minute bus ride, so it's pretty nice start to my day. And then like it was mentioned earlier, we are given pre-recorded lectures and class material that we should look at ahead of time, so we come prepared to class. And then I enter the classroom, and how the classrooms are set up is it's kind of like circle groups, so you are facing everyone, which is really nice. And how the class is basically structured is that the lecturers go in knowing that you review the material and everything, so it's a bit more interactive. So I know with pharmacology, they give you like case studies, and you talk about it with each other, and that's very different from just listening to them nonstop talking. I really like how they push for us to teach ourselves and teach with each other. I think that's a very very different and effective approach that makes the day go by much faster. And then so that's like a day with only lectures, and then if there's like lab in there, we just go upstairs, and they have everything kind of modeled out to look like a clinical room, a hospital unit, or like I know they have like a home health one to look like a home. So we go to one of the rooms and just like practice all of the skills that you would use. So when you do go onto the hospital with your clinicals, so for me, I'm going to the UW hospital here on campus, and I'm working on the stroke unit. And so it's really nice to have that practice that we learned in the labs to put into the unit and just help everyone on the floor out.
Yeah, similar to Alex, since we are taking the same classes, it's super different, I feel, than other nursing programs, that we all have our classes, if we're in the same year, together. Our lectures are all together. There's 160 of us, and 160 of us sit in the room. So we get to hear everyone's answers or everyone's perspectives, and obviously we're all different, so we have different lived experiences, so we all have different things to say. And I really enjoy, we have like microphones so we can hear everyone, and it's so cool to learn in like such a big classroom, but it doesn't feel big, because we'll do little breakout groups, or we'll talk as the whole class, and it doesn't feel intimidating or big, which I find so weird. If there's 160 people, usually you feel like you're just one of another face in the crowd, but I definitely don't feel that way. And then something I really enjoy, at least in our first year, is the tight knit group that is your clinical group. I love my clinical group. Actually, some of you guys saw us in the lab last week, and we all just get to, I guess we get so comfortable with one another. We have lab and clinicals and like our lecture courses with each other, and we're basically with each other all the time. Today I had my clinicals and we all drove together at 5:30 in the morning, and they dropped me off at 2:30 p.m. So we were really together all day long. And I guess for me personally, being more comfortable in a small group allows me to ask maybe dumb questions, like no question's a dumb question, but something that may seem scary to ask in front of a bunch of people that you don't know. I feel comfortable asking something like that in my clinical group, or we feel comfortable putting each other on that hover mat and sliding each other back and forth, or putting each other in the bed and trying to make each other roll back and forth, just because we are in such a small group with our one instructor. There's 8 of us for one instructor. So I really enjoy them giving us a big space with lots of people to learn, and then also providing us time to be in a smaller group and having ways to learn. So kind of people who may learn differently. Sorry. That was my clinical group actually just texting me. People who may learn differently have the opportunity to be in 2 different spaces and kind of can make it their own.
Yeah, so my schedule looks a little bit different second year. So we have classes 2 days a week, and those usually go from about 7:45 a.m. to I think the latest is 3:30 p.m. Um, so we fill all our classes within that time with 15 to 30-minute breaks. So not much time to have breaks. And then 2 days a week, I meet with my preceptors. So it's my nurse one-on-one. This semester, I'm currently working at a diabetes clinic. So I have a different setting other than bedside nursing. So I really appreciate that experience because it's not something that most students will be doing this semester or probably ever in their 2 years with the nursing school. So I'm enjoying that so far. With the preceptor, it's a lot more intimate rather than 8 people to one instructor like first year. You get to ask a lot more questions. You kind of get to take more control as well, just because you already had that first year to practice. And then second year is when you get your own patients. You look ahead in the schedule, see what you need to do for the day. And then even I get to on triage, so I'll be able to answer calls and try to come up with answers on the spot or direct them to other resources. So it's also still a lot of learning, getting used to the unit and everything, or the clinic, I should say. But yeah, and then some days, scattered throughout the semester, we have these simulations. So this semester, I will be doing a mock code, and I'm actually doing that this Friday. And with this specific simulation is you work with other healthcare professionals, such as other nursing students and students from the pharmacy school. And there's a few other ones, I believe, med students, but you work with other people that you would see in a professional level as well after you graduate. And you're there for about 2-3 hours and you work together for different scenarios. Another one is a birth simulation. So things that you won't do on your own unit that you can, at least get that glimpse of in simulation. They definitely have those built throughout the schedule because the nursing school really just wants you to get as much experience as you can to try to influence or inspire your decision for where you want to go postgraduate. So yeah, a little bit different than first year, but ultimately you're always going to be learning just in different ways.
Wonderful. Thank you, three. Okay, I'm going to open it up to the group.